Hello friends, today is my very first lecture and I hope you people get it. Okay, let's start. Let's introduce pharmacology. What is pharmacology? Basically, it is a science that deals with action of drug. If I say that it's a backbone of medical science, then I would not be wrong, definitely. And it's a Greek word and that is derived and pharma mean drug and co mean action and logy mean not knowledge. And pharmacology is also, if we describe in an advanced language, we can say that it's the interaction of chemical or drugs in living organisms to bring about physiological changes and to produce biological response or pharmacological response. It's in advanced language. And it can also be described if we say that it deals with the knowledge of history, sources, physical and chemical properties, biochemical, physiological effects and mechanism of action, absorption, distribution, metabolism, excretion and therapeutic uses of drugs. And it has many branches, number of branches. Literally we talk about branches. First we must know about the term about drug. What is a drug? Drug is a chemical agent which is used for diagnosis, mitigation, prevention and cure of a disease. How it works and how it reacts with our body and how our body responds to a drug, all this study we will continue in the next clip. And but first we talk about how drug act as an diagnostic agent, as an mitigating agent, as an preventing agent and a curative agent. One by one I will elaborate everything. First we will talk about drug as diagnostic agent. In this I will tell you how it act as a diagnostic agent. For example, sodium citrate or potassium citrate is used as diagnostic agent for ESR, which determines a various destructive function of the body such as tuberculosis. And another example we have sodium citrate or potassium citrate is used as anticoagulant because it forms complex with the calcium ions present in the blood. And other example is sodium iodide is used as diagnostic agent for thyroid gland. It defines the enlargement of gland or tumor present in the thyroid gland. And last but not least, we have an example of barium sulfate, which is used to wash the stomach before surgical operation to get a clear X-ray of GIT. One by one I will write, and also you people know that what are its function too. Here I have write all the diagnostic agent that I have already mentioned and their function too, and all these are encircled with the black pointer you can see again. And next we will talk about mitigating agent. First we have to learn about mitigating agent. What are mitigating agent? These are the agents which are used to reduce the intensity of any disease, any infection, which may be severe, mild. So I will tell you about some examples what we use as a mitigating agent, and I will also write their treatment too. And don't worry, we will discuss in detail. You may get everything very in detail. Yeah, here it is, salbutamol. Salbutamol is very common used drug for asthmatic patient. It is used in the bronchodilator in the treatment of bronchial asthma. And there is in asthma there is bronchoconstriction with the dyspnea, which means that difficulty in breathing due to the release of histamine from the mast cells present in the lungs. What salbutamol perform in the body, like it dilates the bronchi and bronchioles to relieve the asthma, right? And next we will talk about hypertensive agent. These are the agents which are used to lower the blood pressure, and the blood pressure which is very common in elder patient, and nowadays it is very common in young too, because of because of this advanced system have created too much anxiety in the youngsters too. So this agent used to treat hypertensive patient, and for example, I can take some agents name like propranolol, atenolol, labetalol, etc. And next we have anti-inflammatory agent, as it name indicates that it is used to reduce the inflammation. And for example, we can talk about aspirin, indomethacin, phenylbutazone, etc. These are the different drugs used as an anti-inflammatory agent. And next examples we have tranquilizers. It also used to reduce anxiety. And in this we have example of diazepam. And next we have antacids, used to reduce hyperacidity of the stomach, which is because of some spicy foods. It often cause because of hypertension, and having different reasons could be, and we use agents to reduce this, that is sodium bicarbonate. And next we have purgatives, which are used to remove the constipation. And H2 receptor blockers are used for the gastric ulcer, to treat gastric ulcer. Gastric problem is very common in those people, especially who take spicy foods, who do not sleep well, and get suffered from the stomach burning and all. These are following examples of mitigating agent. And next we have preventive agent. What are preventive agents? Preventive agents, the purpose of this, that we use this agent to prevent the disease before, like I have write that prophylactic immunization. It means that we use this drug before the symptoms of the disease. Like we used some vaccines to prevent children from smallpox, diphtheria, measles, and cough, and polio, etc. We use different types of vaccine. Next, I have curative agent. These are the agents which are used to eradicate the disease. Like, for example, we talk about chloramphenicol, which is used to cure enteric fever or typhoid fever. And another example is anti-malarial, which is used to cure the malaria. Like chloroquinone is used as anti-malarial drug. We can also give example of penicillin, such as benzyl penicillin, procaine penicillin. These are the different curative agents used to treat pneumonia. So here all about the drug and their different agents which are used to treat or cure or mitigate the disease. So for further information, how drug react with our body and how body react with the drug, so all this information you will get in the next clip. For more information, don't subscribe to like my channel. Thank you.